If I was going to ask you your hope for how your work is carried on, because obviously there's many doctors who have come and have studied with you and who are they're contributors to this work as well, of how they've come and studied with you, how they've used your theories, put it to work in their practice, between those people who will accept the diagnosis and those who won't. How do you...
Well, the problem is there are not many. There are some. And that's the difficulty. I'm at a medical center, and there are people from all disciplines in medicine. A young doctor, who's one of the contributors in the book, incidentally, is the only one in the medical center who has wanted to learn about this and to develop the capacity of examining and treating these patients. The weight, I think of it as a kind of steamroller, the weight of conventional diagnoses and treatment is so enormous, and there are so few people that are willing. It's interesting that a lot of the doctors that I have seen over the years came to see me as patients and then got better and then said, well, heavens, I couldn't possibly practice medicine the way I practiced it before. And one of these doctors told me, the one from Minnesota, Dr. Hoffman, in fact, I think he describes it at the very beginning of his piece, of how this family doctor came to see him and got better and told Dr. Hoffman, what can I can't go back and practice the way I was practicing before. No, this is the point. It's a whole other world, and as far as the future is concerned, heavens only knows. I'm very happy that this last book is out now because it tells it like it is. It puts forth the basic idea, and I'm hoping that, as time goes on, people will see it and say, hey, this makes sense.
Do you think it's simply because Freud has been kind of debunked for so long that they feel that, well, we've debunked him, his theories can't possibly mean anything? Actually, there was a quote that I highlighted, which we were going. It was talking from James Hansel, who's a University of Michigan psychologist, wrote in this Newsweek article. He says, but he was wrong in such interesting ways. But I think that phrase, he was wrong in so many interesting ways, that even though some of his theories about Oedipal complex...
as Eric Kandel said, one of the big problems, and everyone recognizes this, was his early emphasis on sexuality and sexual problems. And, he felt that a lot of the unconscious things were... people were hiding unconsciously sexual feelings that I have. I've reinterpreted 2 or 3 of his cases in the book in which he puts the blame on sexual phenomenon. And I've showed very clearly that these people had TMS, that is the disorder that I've described, and that it was really due to frustration and unconscious anger about the situation in their lives.
So repressed rage being one of the largest as a causative symptom in psychosomatic illness, I wonder if one could go so far as to say it's simply destructive emotions, which...
No, it's emotions that are possibly, destructive, threatening, like intense anger. Certainly that one. But there are many others, like the pain that goes back to childhood. The sadness is not destructive. And these can be very powerful. I think the way to cover the whole area is to say emotions that the brain has decided are too threatening or too painful to allow to come to consciousness.
So speaking of that, sometimes it's better off to let a patient have their pain. Is that possible, that it's better off for them to have the pain for them to really understand?
Well, I'll tell you what happens sometimes. The therapist decides that indeed that person may not be able to deal with the emotions, and therefore they are simply going to support them. That doesn't happen terribly often, but it certainly is one of the... And here again, the wisdom of the therapist is so terribly important in their experience in deciding who they can work with, who they can help to feel the feelings they've been unable to feel. And I've used a good word here now. Feel feelings. And they work on that a great deal. And to take a simple example, someone who has been angry at his father, for example, all his life, but could never in a million years really feel that anger. And the therapist, having decided that this person can deal with this, helps him to feel the feelings that he's been unable to feel. And as he does, the symptoms melt away. That's a good example of what therapists do with many, many of my patients. But if they feel that the patient is not strong enough to do that, then they simply support them.
I guess in one sense we're talking about duality or dualism, the duality between the conscious and the subconscious, or the conscious and the unconscious, or the duality between wanting to be a perfectionist and a goodist, and the other side of that would be, I guess, the libidinous one who just wants to go out and play or have what everyone craves, or the child primitive, as we said before. So how does that concept of duality fit into your...
Well, of course, the danger of the concept of duality is that there are two separate systems at work. And that's why that word is should be eliminated. We should not talk in terms of duality. There is no duality. The mind and the body are one, and they're together. They're part of the same process.
In talking about psychosomatic, there's so many ways to get off track where, I can feel myself where like somehow you are responsible for the illnesses that you have. I mean, in a certain sense, self-awareness certainly helps, but there's so many factors. Well, I think one has to. That's
very interesting. It's fascinating. I never hear from patients that, it must be my fault, in the light of what you're saying. And in fact, you're mentioning this now makes me realize that I simply do not hear that from patients. I think that there are many people who don't accept the idea, who say that may be the reason why they don't accept it. They can't accept it because it would imply that it's their fault somehow. I think that people who have great problems with guilt might fall into that category. But it's really interesting. None of my patients get the idea that they are at fault.
Yeah, it's not my diet. It's like me with weight. It's not my diet of ice cream and peanut butter sandwiches in the middle of the night. It's something about my mindset about them that is somehow making this weight stay on. But, you can spin this out from, where are we responsible? We're responsible in our diet. We're responsible in maintaining our health. We're responsible, I guess, for our happiness, to put it another way, towards, does our work reflect the skills that we have? Do we feel valued in life? I mean, there's so many things that go into what are the daily pressures of life. And when we're talking about psychosomatic, I mean, that's really the kind of breeding ground for some of these illnesses, isn't it? From what we repress.
A mind-body disorder is always a reflection of what's going on inside. But this is why they're universal, because what's going on inside in every one of us is going to be something that the brain's decision maker, the mind's decision maker, decides it doesn't want it to come to consciousness. So yes, it's what we're all about. It's the way our personalities have formed. We've used the word personality for the first time now. If you're someone who puts yourself, if you have this perfectionist tendency or these goodist tendencies, these are part of your personality. If you have a problem with self-esteem, like a lot of us have had all of our lives, that's part of your personality. That indeed is, in my view, the thing that pushes most people to be perfect and to be good. That what they're doing is really reacting to the feelings that they have of unworthiness, of inferiority. And this, incidentally, is an idea that Alfred Adler had, and that Freud, so far as I know, in those early years didn't make anything of.